But to do some introductions first I'd like to introduce Tina Henry. Say hello, Tina.
Hi.
That should mean you see Tina's face, which is a big relief after having to look at mine. Tina has recently joined KHES as a senior consultant, although I have worked with her quite a long time.
We won't go there.
We won't go there. But she's also standing in as practice manager in the Greater Huddersfield area. So she is one of our consultants who's very experienced in staff management issues, and she'll be giving a sort of background to it. Second person on the panel today is James Rowland. Say hello, James.
Hello, everybody.
Very diffident. James is the practice manager at the Ashton Group Medical Centre, which is a group of 3, I think, surgeries that joined together recently. And he's the person that we were working with in restructuring. So they'll both be giving their insights into the restructuring process. And then what I will do at the end is give a bit of legal advice on if you are looking to restructure, the sort of important things to bear in mind, particularly in relation to the legality of changing people's contracts of employment, which is something that may be necessary. But just on a general observation of what's happening, obviously since March the 23rd, when we all went into lockdown, it is our impression, certainly across all of industry, not just in primary care, that people are much more accepting of change at the moment because they've had to go through some pretty drastic ones so far, whether it's been furloughed, whether it's having to work from home, or like us, having to work from home with teenagers running around demanding endlessly where the burgers are and why have we run out of crisps and all those things that you get asked by teenage sons and daughters. So we've had to make those changes, and sometimes those changes have been positive and sometimes they've not been positive. We don't make any judgment in terms of your practice as to which way that goes, but what we certainly are aware of is that people are more accepting of change than perhaps they would have been prior to this event. So I'm not going to waste any more of your time. It's time we talk to people who know what they're doing, Tina and James. So Tina, if you're okay, I think we'll hand over to you and I will switch my mic off so you can take control of this. Okay, Tina, as I say, any questions, put them on the Q&A panel and we'll come to them at the end of Tina's bit of the webinar. Thanks a lot.
Okay. Thanks, Karen. So throughout June, I contacted a number of primary.
Oh, Tina, you've gone on mute. Hang on a second. Kieran, you're on mute as well, I think.
This is the sort of thing we need to iron out. Tina, I've muted you, I think, somehow. You need to click on bottom left.
I've done it.
Right. Sorry about that.
That's okay.
Start again.
So, okay, take 2. So through June, we contacted a number of primary care clients to discuss the pandemic and how it had affected all the different practices. And as a result of that, what changes you'd had to put in place at very fast pace, and maybe some of them you wanted to keep on a permanent basis. The summary overall, I'm just going to give you a brief summary of what the findings were. So in the main, the majority of the practices were really impressed with how quickly that you all had to react to the changes. And they were very ambiguous times, but despite that, actually you coped incredibly well. It was clear from talking to you all as well that it was easier to go into the lockdown than perhaps it is coming out of this situation. And I think that's a general consensus across the board. And I think despite the numerous changes, a lot of practices reacted really, really well and actually are very keen to continue with some of those changes because you've seen the benefits of them. And some of those benefits have obviously been things that maybe have been in the pipeline to bring about, but this pandemic has actually brought it to the fore and made you realise it's worth keeping for the good. The case study will explain a little bit as well more later on around how we've involved these 2 kind of processes together really. So some of the pros of actually the pandemic situation that I gleaned from you all as part of this process. So the closure of the practices was implemented really well overnight at a rapid pace, and I think a lot of you felt that you managed it really, really well. the situation has reinforced that a lot of face-to-face consultations are not necessary, so therefore that the teleconsult option works really, really well. Technology has allowed you to do that, and I think a lot more people have therefore had to embrace it as a result of the pandemic, and it's meant that the services in the main have been able to be delivered efficiently, effectively, and most importantly safely as well. It's also helped signpost patients accordingly as well, and again efficiently, which is obviously really important in the practice world. In terms of staffing, there was a reduction initially in activity coming into the practices, so less staff were needed, but the introduction of technology has also emphasised the fact that do you need as many staff as you've actually got, so streamlining those processes. Patient-related, obviously demand for appointments reduced, improved timeframes for appointments therefore, and this obviously resulted in a less grumbles coming from patients because the ones that needed appointments were able to get them. And obviously that's improved satisfaction in that respect. But the general feedback from sort of a lot of the practitioners was feeling supported to prioritise clinical work during this time over everything else, which is obviously really important. Actual time to focus on being a doctor. The temporary postponement of appraisals and revalidation gave you a bit of a breathing space, and it made a lot of people feel recognised and appreciated for the work that they do. And the sharing of experiences was something that was mentioned as really something that they've taken away from this, that's something they'd like to also retain moving forward. There was also cons to consider as well. So there was a consideration that sometimes the teleconsultation approach also created duplication because you then did have to bring them in for a face-to-face as well. And also the reintroducing of the services is something that's becoming harder to put into place, and there's extra considerations that need to be considered. From a technology perspective, there were mentions about technology systems being outdated, servers crashing, which obviously impacted delivery of service at times, and not all clinicians felt comfortable using the technology, so that had some disadvantages as well. And the learning at a very fast pace, doing it in a different way and having to learn at a very fast pace was also kind of a key point that was raised. I think the biggest cons that kind of came across were less human contact. I think that was missed because it's been such a switch from face-to-face being predominant to telephonic, and difficult in some instances to build a rapport, which is obviously really important. Concerns that a serious diagnosis could be missed, and reluctance from some patients to take the medical advice via the telephone. And not all patients, again, confident in using the technology. Patients not answering at the time when the call's made, which is obviously a massive problem if that continues to be a regular thing. And some patients just don't like it and are therefore maybe going to cause, they may complain as a result of that, which is something obviously we want to avoid. But the general feedback as well was that it did feel at times like it was the blind leading the blind. The volume of information that's had to be digested in the different forms, tweets, WhatsApp, emails, it's been huge. And it's felt at times as though the teleconsultations is never ending. And then you've got face-to-face to fit in, you've got home visits to fit in. And sometimes that made some clinicians say they felt a little bit overwhelmed. So using that information, when is the right time to implement change and what are the key considerations? So Kieran's already mentioned, use this time now to capitalise. It's probably never the better time really. People are going through this uncertain period and they are more likely, as Kieran said, to continue to agree to change at this moment in time. Knowing what's worked well for you is a really key consideration. If you know what's worked well with you, if you don't, and you now on the back of this, review what's worked well for you and have to think about what you do want to keep going and how you're going to do that moving forward. Understand why you want to make the change. This will help with your project planning, and I think that's really key, and how you communicate this out to your staff. And I think if staff understand why you're proposing change, you are more likely to get their buy-in from the beginning of that process. And then it reduces conflict, it reduces negativity towards any kind of rollout of any change. Having a project plan and a clear communication from the beginning also means you keep to your timeline. Keeping to your timeline reduces your costs, and that's obviously a very important factor for us. And then the clear communication, ensures also you reduce the risk of losing those key staff you don't want to lose, because when you do introduce a change management process to an organisation, you will naturally get sometimes you get natural wastage, and you want to keep the people you want to keep, and you actually might have some people you're happy to lose. And then finally, legal considerations, which Kieran's obviously going to go into a little bit more detail, but what does it mean? Changes to terms and conditions, if there's a redundancy, is it consultation process? What does that mean? How are you going to select people if it does mean you're reducing headcount? And all these things have got legal elements to it, but they're not, they're easy to work through. So, and there's lots of help we can give you with that anyway, if you do decide to go that way. So any questions on the back of that? Is there anything you want to answer now, Kieran, or do you want to wait till the end? Before I hand over to James.
No, I've got no other questions have come in. Has anybody got any thoughts or questions about what Tina's just said? One question, I'll give you a couple of minutes. One thing that does occur to me though, that obviously during the cut and thrust of the day-to-day, it's sometimes difficult to spend time thinking about the structure of the practice and how that can be best used for your benefit, and to give that sort of thinking time. If you want some kind of facilitation meeting where you get the partners together to talk about whether there are changes you want to make, I'm sure we can help with that. Just give us a ring, and maybe that's sometimes the first stage, is actually as partners, or as your partners, if you're practice managers, need to make a decision on what changes you want to keep, and sometimes you need to have somebody facilitating that discussion. If that's something of interest, give us a shout. No more questions coming in. I can't see any. James, I'm going to ask you to unmute now, and then you have to unmute. There we go. Are you unmuting? There he is. So I'll hand over to James, and now I will properly mute Tina, which is what I didn't intend to do last time, but did with remarkable skill. And as I say, any questions, please pop them in the Q&A box and we'll be happy to answer them. All right, James, over to you, mate.
Thanks, Kieran. Yes, so as Kieran mentioned, I'm James Rowlands, practice manager and non-clinical partner at Ashton Medical Group. I'll give you just a bit of a brief history about the practice, because maybe if you're in the same boat or thinking about going into the same boat, it might help you. And I'll run through some of the successes and challenges that we had along the way, and give you some tips that you may find useful or maybe not. So to start things off, Ashton Medical Group is a newly merged practice. It was a merger of 3 practices in 2018. We've got about just under 20,000 patients, and we had around 65 staff not so long ago. A bit of background, the practice merger was brought about because 3 practices were struggling for different reasons, some financial, some because of demand, some because of partners leaving. And initially when the practice came together, the decision was made by the partners that were staying was that no jobs were going to be lost or changed, and they wanted to bring everybody into the one new practice in the roles that they were currently doing. Obviously, as you can imagine, that did leave a bit of an operational problem and challenge. I joined the practice in August last year, so about a year after the merger, after a few changes in management. And I think coming in with a fresh set of eyes and not being part of that process really helped myself personally. We noticed that there was, I think when I came in, there was 10 non-clinical job roles in the practice, which for a relatively small organisation is a lot of job roles. There was people working in silos. There was certain members of staff that people didn't know what they were, actually doing, how to do their job, and there was no resilience or cover if they were to go off. It would simply be that we would have to learn the job from scratch. Initially, there was a bit of a split between some of the partners in deciding how best to improve the practice performance and change the way of working. I think initially it was decided that the problem was that there was not enough staff, and some partners felt very strongly about that. So eventually, after some discussion, the partners agreed to hire some more people into the practice. So I think there was about 4 new hires made just before I'd started last year. And I think what had actually happened was that even though we brought the 4 members of staff in, we didn't see any improvement in performance, and none of the job roles were changed. So we still had the same problems of a lack of resilience and poor performance in some areas. And we found it hard to get people to change shifts or work different work patterns or cover people's annual leave. So I'd initially contacted Kieran actually not long after I'd started. We were in search of a new HR provider. Actually, when I initially met with Kieran, I think I mentioned that we had started to discuss a restructure, and it was something that we might want to look at. We decided to give it some time and have a think about what we were doing and let the new staff bed in, and obviously try to avoid any job losses where possible. We did try to move people around a little bit and some performance management, but we still found it tough. So this obviously brings us to around February, March time when the pandemic started. And as Tina mentioned before, we completely changed the way we work. We had to, as most places did. So we really embraced new technology, embraced a lot of telephone, video, online consultation. But another thing we did was, because we had so many staff, we had quite a few sitting around and actually asking us about furlough. So I had got in touch with Kieran to discuss an internal furlough scheme, a voluntary one, which we managed to set up. And I think what we found during that time was that there were certain people that didn't particularly want to be here and weren't happy and were happier at home. And also that the issue wasn't actually numbers, because we'd allowed 7 or 8 people to go on furlough, and realised that actually we thought we were right around the restructure that was needed, because it was more about the way we were working than the numbers of people that we actually had. So we contacted Kieran again, who introduced us to Tina, who came and had a number of initial meetings with us to plan things out. And they really clarified what they needed, which was some very clear goals. They needed some idea of what we wanted to do and where we wanted to get to. For us, it was a lot about bringing some flexibility and resilience into the practice, but also there were obviously financial implications as well. Like everybody else, we had no idea how long COVID was going to last. There are some elements of the income that we're not sure how or when they'll return, and we had to future-proof the practice alongside improving our performance. So I think what we did was we planned really effectively with Tina, and made sure she had the information she needed. Tina communicated really effectively with us and quickly, and allowed us to plan and get out our communication and our selection criteria to the staff, and have one-to-one meetings with the staff, and then go through a process of interviewing people and seeing who was right for the job. I think I'll probably move on to some of the successes rather than going through the intimate details of the process. I think what we would say made the process a success was the planning stage initially was really important. I think internally we had to make sure that we had a goal as a partnership. We had to make sure that everyone was on the same page, and that there was only a small number of people that were responsible for taking the process forward. It was myself and another partner who led on it, and we tried not to include too many voices and make sure that we had internal agreement. With regards to the planning of what we were going to do, I think we were quite fortunate in that I was a fresh set of eyes coming into the partnership, and understanding where we wanted to get to and having no sort of emotional ties to ways of working. So I think what I would advise other practices who are considering this to do is that if you aren't sure what you need, it is best to use those fresh set of eyes. Having worked with Tina very closely, she was able to provide suggestions and ideas that we may not have thought about, and just having her as an external pair of hands and speaking to the staff and getting to know them, it just gave a bit of impartiality, and I think it allowed the staff to feel like there was no prejudice against anyone, and it was purely a business decision. I think another thing that made the process a success for us would be the workload review. So we ensured we looked at every level of the practice and every job that gets done, and who does those jobs, who's best placed to do them, and when do they need to be done, and making sure we factor that into a rota and our job descriptions going forward, so that we have the resilience and the flexibility that we needed going forward, and making sure that people that were wanting to move into new roles understood exactly what they were going to be doing and when they were going to be doing it. One of the biggest success factors was definitely around the communication. It was really effective and timely communication, especially from Tina, that was helpful. It allowed our staff to know exactly what was going on at the earliest point possible, and it was very clear about what was going to happen. And it was very clear that both myself and Tina impartially were going to be there if anyone wanted to discuss anything. And we did have a lot of one-to-one meetings, and I think a lot of that reassured staff. And I think as well, the communication from between myself and Tina was important to get right, and making sure that, as she mentioned before, we stuck to timelines, which we managed to do. We managed to run the process very effectively and as quick as possible without rushing anything. I think lastly for us, one of the most important points was to be honest between myself and Tina about our goals and exactly what we wanted to do, and performance and where we needed to get to. But also, I think honest communication to the staff. I think people definitely respected being told the truth and not having things sugar-coated for them, made them aware of exactly what was happening. And I think they appreciated that. I think that level of honesty created an atmosphere where the staff felt they could be open. And actually what came out of the process for us was, it was clear that there were a lot of people that had been here for many years who were at a point in their lives where they didn't want any more change. They weren't really interested in the new job role, and they weren't actually really interested in working here anymore. And facilitating those discussions and speaking to them about their options really helped them make their minds up. And I think a lot more people than we would have expected took voluntary redundancy, but because they never thought it would be an option to them, they were actually quite happy to take it. And it left us with a staff team that really wanted to be here and wanted the practice to succeed. I think what we did with the job descriptions and the contracts is we made it clear that they were going to change to what the practice needed, and they were going to offer a lot more flexibility, not only around hours, but around different types of jobs. So people weren't working on their own and just doing one job. Everybody shares responsibility. I think probably the main tips that we would give anyone considering this would be to review your structure from top to bottom. Even if you're having an issue with just one team or one person or one set of people, it's important to, as cheesy as it sounds, look at the bigger picture and see what else might be affecting that team. And whilst doing that, aim to create a structure that will last and meet your goals and doesn't just resolve one small problem, because the last thing you want to do is go through this process over and over again, because as much as it is a business decision, it is obviously tough to go through. It's tough to see people upset, and it's tough to see people go sometimes. So we'd obviously advise to do what we were advised to do and look at everything, or as much as you can, in one go. And the other thing I would say is to ensure that your selection criteria matches the type of person that you want for a new role. So maybe it's not just skills or experience, but it's personality as well. For us, we had some people that were certainly less experienced, but their personality and dedication and commitment to the job shone through, and that's really what we wanted. And I think the lessons learned, or things that we'd do differently, perhaps, we'd actually probably have done it earlier. I think everybody was a bit scared of upsetting people or how it might go, but actually on review, if we'd done it a lot sooner, we would have sorted our problems a lot sooner, and we would have had a much better performance with our call stats and with our workflow and admin processes. And I think the other lesson we've learned is that if we were to merge again or take on another practice, we'd definitely undertake a business review, a workload review beforehand, and potentially look at restructuring beforehand to ensure that it fits together, rather than having to go through, years potentially of poor performance in trying to sort things out. If you've got any questions for me, please feel free to ask either now or later. More than happy to answer. And if there's anything I've missed, Kieran or Tina, you want me to speak about, please do remind me.
Thanks, James. I'm conscious. Yeah, Dina has asked, James, how many patients have you got and staff at the moment?
So we're still around 19,000 for patients. We're down to 50 staff now.
50 staff, right, okay. And how does that split between clinicians and support?
So at the moment we have 11 patient advisors, which is what we call them now. It's the new merged role between admin and reception. We have 3 secretaries and 4 managers under myself.
Well, one of the things I've realised is that there's I think that should be, is that okay, Dean? What I'm going to say is that there is a system here. If anybody wants to say anything, because that might be easier than typing it, if you put your hand up in the hand up bit, I'll unmute you and you can actually speak. So if anybody wants to do that, stick your hand up and I'll introduce you into it. So, because as I say, sometimes what you want to say is kind of difficult to type. So say, just put your hand up and I'll unmute you and you can say what you want to say. All right, look at that, hand's gone up already. There's Adina again. Right, I'm going to allow Adina Cadman from Penketh Surgery to talk. Are you there, Adina? You need to, yeah.
I am. Hi. It's just a question for James, because obviously you've explained how many staff you've got. How's that split between 3 sites? Do you have one site doing all, so all telephone calls come to that site for appointments and that? How's that actually managed?
Well, we're actually quite lucky in that the buildings are a stone's throw away from each other, but we do have a split. One building is our admin site, and one building, it was 2 buildings, but it's been knocked through to make 1 building, but that houses our phone hub. But I think our way of working is we're planning to go from what is the sort of phone hub building now will become our unscheduled care, if you like, and then the other site will become scheduled care, so nursing appointments, baby checks, minor surgery, anything that you schedule comes into this building, which is the way we're planning to work it.
Okay. Okay, Adina, does that answer your question?
Yes, thank you.
Okay. Right, Sarah Vannan, I'm just allowing you to talk. If you click the unmute button, Sarah Vannan, you'll be able to speak. There you go.
Hi, James. It's a question with regards to, it's not an easy thing to restructure the GP practice, and you've done it really well. And I could see that you are now better than what you were in the past. How did you sort these estates problems out? Because you got 3 sites, or did you encounter any estates problems?
So, I mean, one thing we did is that we ensured that our contracts, new contracts and job descriptions included clauses for working between sites or anywhere else that might be asked. So we tried to future-proof it as well. If we do take on another practice, that we'll be able to move them between sites. And to be honest, it was just part of the consultation with staff. I mean, we were quite lucky in that the buildings were close together and staff weren't too opposed to working across site, but again, we just make sure that people are actually doing it, so that people are rotated to go between sites so that they get used to it. And like I say, making sure we're covered within our contracts and job descriptions to make it known that that was what they were signing up for in the new job role.
Great, thank you.
Okay, Saran. Yeah. Okay, no other hands up, no other questions, that's good. I just wanted to draw out a few of the legal points that come from what James and Tina have been saying. First thing, I'm going to make a comment which perhaps will come as a surprise. It is my experience in every sector that actually your staff know fine well that restructuring is required, either because they understand that perhaps things aren't working as smoothly as they could do, or because they recognise that actually the amount of work they're having to do in their role is going down. And that's particularly for some roles where the roles have changed, and we know that in the health sector things change all the time. So I'm always saying to people, don't expect people to be that surprised when you come along and ask them about restructuring, because most of them have been expecting it, even if the ones who've had very little work to do but are still getting paid have kept their heads down for the past 2 years, because there are people who will do that. So that's the first thing to say, is your staff will be more tuned in to what's happening in the practice than perhaps you realise. You know, they are spending quite a significant amount of time there, so they will observe what's going on. Second thing is that there is a big culture change, I think, in what James and Tina were doing at Ashton, and what you often see in practices. I quite commonly see practices where the management of the practice is much more focused on the staff and flexibility and being able to offer work patterns that suit the staff. And I think what's happening now is you have to concentrate much more on what's good for the business. And so sometimes that means saying to staff, I'm sorry, we don't need you for the times that you want to work, for whatever reasons. And often they're very good and understandable reasons, whether they've got sick relatives or people who need care and all the rest of it. Unfortunately, as an organisation, you can't always accommodate those. And that's a real change in culture for a lot of you, I know, because I know virtually all of you try hard to accommodate your staff whenever you want to. So it's a move perhaps from a management culture which looks at the employees' flexibility first and looks at the business culture second, and it should be swapping that round now. And obviously you will try and accommodate employees, but first and foremost, you've got to make sure the organisation thrives. And if you like, what that says is that if we're talking about the organisation thriving, that actually benefits all the staff. If you're looking at changing the work pattern of an individual member of staff, that benefits just that member of staff. So it's a different way of looking at it. In legal terms, that is perfectly acceptable, and that's the way that the law will expect you to operate as a business. If you are taking over a practice, something that James was talking about is doing the review before you take over. If you are taking over a practice, there's a possibility that these horrible things called the transfer of undertakings regulations will kick in, which protects the contracts of employment of the people that you're taking on. What you can do is during the taking over process, you can start a consultation on what are called measures. In other words, the things that you intend to do with the practice once you've taken over. And you start that process with the existing staff before you actually take it over. That's a legally required thing to do if you do envisage any changes, but it also helps you get some flavour of what room for manoeuvre there is with the staff that are there before you take it over. So I think it's worthwhile thinking of that if any of you are thinking of maybe merging, bringing the practice under your control, that you talk to us about what measures you want to take, and we can talk about how you can consult about those before you actually spend any money on taking over the contract. Once you have taken over, you are entitled to review under rules that are called the economic, technical and organisational rules of redundancy. So if following the takeover you have to make changes, you are entitled to do that. But again, you have to follow the legal rules which lead to a redundancy. Just to be clear, a redundancy is described very clearly as a reduction in the need for work of a particular kind in a particular place. That's been set out by the courts since the 1980s, and it goes back to a case called Williams versus Compare Maxim, if you really want to be bored with the legality of it. And what that says is a redundancy is about reduction in need. It's not about a change in the way the work is done. So, for example, if you have cleaners coming into your practice and the operational needs of, let's say, the enhanced opening hours means that those cleaners can no longer do their work in the evening and they have to move to the morning, there's no reduction in the need. You still need the cleaners, you just need them at a different time. And there's every possibility that those cleaners won't be able to do it at that different time. That's not a redundancy. That's a different type of dismissal called some other substantial reason, but don't worry about that. We'll talk about that in proper English if you ever come across it. So that's a different approach. So if what you're doing is not actually having a reduction in need, but changing the way the work is done, you may not have to pay redundancy pay for people who can't change their way of working. The legal requirement is that your need to change is greater than the need of the individuals to keep their employment contract the same. All of this does get very technical, and I do have to say that in my experience, redundancy is one of the technically most difficult areas to dismiss on. And in one of my sort of regular rants, do not try to hide somebody's poor performance or poor conduct or poor attendance underneath the banner of redundancy, because it will fail if it ever gets tested in court. A redundancy must be about a change to the organisation, not just a change to individuals. And as I say, we're happy to deal with all of that. If you've got somebody with performance issues, deal with the performance issues. It's actually a lot easier than doing redundancy. Bottom line is this, and I'm conscious I don't want to keep you longer than 45 minutes, and we're getting to 40 minutes now, is that from the point of view of consultation, it is important that all of the partners are clear about the changes they want to make and why they want to make them. And as James indicated, that once that decision is made, the partners step back from that decision to avoid the natural inclination of the staff to approach the partner they think is either the softest, their mate because their kids play football together, or whatever reason they think they've got a special connection with the partner, and use that partner to lobby for their preferred outcome. Partners must be aware that that will only distort the process and actually increase the legal risk of making these changes. It's when you try and, if you like, twist the changes to match individuals' personal influence, needs, whatever, that's when courts start getting a little bit naughty and you start finding yourself paying out lots of money for representation and awards. I think that's about all I've got to say. I don't know whether James and Tina have got anything they want to add.
No.
Oh, James, shaking of heads. Well, thanks very much.
No, I'm happy to. If anyone wants to get in touch with me aside from this and discuss it further, I'm more than happy.
Brilliant. Thanks for that, James. What we will be doing is we'll be emailing you out a link to this recording and also the documents that we've relied on, so you've got it down in paper format to read through if that's how you would prefer, with our contact numbers should you wish to get in touch and just ask us any specific questions. I know what it's like. I often wake up sort of 5 o'clock in the morning and think, oh, I wish I'd asked that question. So if that happens to you, please ask, but no point in asking it at 5 o'clock in the morning, because from me, you just get a load of rubbish that time in the morning as I'm trying to make cups of tea. So anybody, anything else they want to say, stick your hand up. If not, I'll draw this to an end. And please let me know if this is a method of communication without the sort of muck-ups that I do by pressing the wrong button. We'll perhaps get that right next time. But if you prefer to communicate in this way, we're more than happy to accommodate that, because it is a good way of us pulling things together. Okay. All right. Thanks, everybody. Thanks for listening, and I hope to see you soon. Bye-bye now.
Thanks.